everyone and welcome. My name is Dinah and I'm a registered nurse. Today we're going to be looking at the departments to find at a health facility. When you go to a health facility, there are mainly two departments. There's the outpatient department and the inpatient department. But also, these two departments have other subunits. Now, let's start with the outpatient department. Most facilities now have an outpatient department. This unit is usually located at the entrance of the facility. The advantage of the outpatient department is that much of the investigative work and curative work can be done there without actually having to admit the patient. What do I mean by this? It means that when you reach OPD and you're not very sick, but you need tests like laboratory tests, your blood work to be done, or you actually need imaging tests like X-ray and scan, they can be done without you actually having to be admitted. Now, let us take a look at the subunits that are found at the outpatient department. There's the consultation. Usually these are rooms that are designated for a patient and the health worker to communicate and interact together. Meaning that you'll enter the consultation room, find a doctor there or any other health worker to work on you. Next is the laboratory. The laboratory is also another subunit where blood work is done or samples are taken off to further investigate what someone is suffering from. Next is the imaging unit. The imaging unit is where scans and x-rays are done. They also help in the diagnosis of illnesses. At OPD, we also find special clinics. These are offices or rooms that are designated to see specific patients like diabetics, hypertension. There is also the dental unit. The dental unit is also part of OPD, where all things concerning teeth and oral hygiene are taken care of. Next is the pharmacy. The pharmacy is where we pick our treatment from after we have been prescribed for. At OPD, there's also the accident and emergency department. This is where all emergencies, be it accidents, be it anything medical, as long as it is an emergency, it is handled at the accident and emergency department, so that after, in case the patient needs admission, they are sent to ward. There is also the physiotherapy department or the physiotherapy unit at OPD. This is where anything that has to do with rehabilitation is done. Lastly, there is also the cashier department or the cashier's unit. In a private hospital, usually there is a cashier's unit. This is where all payments are done after you've received services at a given health facility. Now, some of these departments are not in every health unit that you go to. And the departments that I've mentioned are not all of them. There are others that I've mentioned a few. Having looked at the units at the OPD, let us also take a look at the units in inpatient department. Inpatient department is where patients who are very sick and require management for a longer period of time are admitted or hospitalized. The subunits in this category include the maternity ward. This is where all women who are pregnant and have come for delivery or have other issues concerning pregnancy are admitted or managed. Next is the surgical department or surgical ward. The surgical ward is where everything surgical, as long as at OPD, the health worker made a diagnosis that you have a surgical condition, you'll be managed in the surgical ward. Next is the medical ward. Medical ward is where all medical cases like malaria, typhoid, anything medical is managed. But also, some units tend to divide medical ward into two, where they have a female medical ward and a male medical ward. Next is the pediatrics ward. Pediatrics ward is where children 12 years and below are managed for any case that they present with. They are not mixed with adults. They will always be put in the pediatrics ward. After the pediatrics ward, there is the neonatal intensive care unit. Neonatal intensive care unit is where children or babies or newborns are managed for any condition that they have, because they need a lot of intensive care. Next is the intensive care unit. Now, intensive care unit is for adults. Intensive care unit is where all cases that are critical, very, 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 very sick patients are put. They are managed in that ward. Next, we also have the gynecological ward. This is where women presenting with other conditions that are not pregnancy related are managed. Lastly, we also have a theater. A theater is where all cases that need operation are done. We also need to note that not all the wards that I've mentioned can be found at all facilities. Some facilities do not have all the wards. Other facilities have these wards and more. Some are specialized, some are not. So, the few that I've mentioned are the common ones, but there are also others. I hope someone has learned something today, and don't forget to like, subscribe, and leave a comment. I'll see you in my next one. Bye.